once again to everybody, and to our American friends. I think it is appropriate to celebrate the 4th of July, which is the day of Declaration of Independence of the United States. And in many ways, the United States Declaration of Independence from the United Kingdom anticipated many of the struggles for national liberation all over the world. In fact, Vietnam, Ho Chi Minh, basically incorporated some of the sentences from the Declaration of Independence when Vietnam declared independence itself. So allow me now to turn to my PowerPoint, and I hope you can see my PowerPoint. I'm sorry I cannot use the full screen function, but I hope this is enough. Are you able to see the PowerPoint?
Yes.
Okay, very good. Now, I think that I'm basically presenting two different, making two different presentations. One is a major challenge faced by many developing countries, which is how do we have sustainable healthcare financing? The WHO has a slogan of health for all, which almost all countries in the world have signed up to. And the Sustainable Development Goal, one of them is for universal healthcare. But how do we achieve this to make sure that there is sufficient financing? And I will be discussing some problems associated with that. And then the second presentation I'm going to make, which is basically on how to improve nutrition. We have paid a lot of attention to food security issues, but I think it is also very important for us to pay much more attention to questions of improving nutrition. So let me move to the. I think everybody knows the problems of the U.S. Healthcare system. Even though I think many people do not realize that a lot of there are some socially government finance things like Medicare and so on, which makes the situation not as bad as it would be otherwise. But basically, we have the US and a few other economies in the world having what is private or voluntary health insurance. And this, of course, basically means that only those who can afford it participate. And so the insurance risk pooling, what the insurance people call risk pooling, is only for those who can afford it, for the people who are relatively wealthy. And it's also important to recognize that as a result of that, there is a whole bureaucracy associated with insurance management. And there is also, as a consequence, insurance companies do have a lot of problems, including what is called moral hazard and cherry picking, which allows them to maximize their profits, because that's what they are in the business for, not to take care of, to improve the health or well-being, but rather to make as much money as possible from the health insurance system. Now, the people like us who basically pay for healthcare in the United States because they participate in insurance as individuals, they do not have much negotiating power with the healthcare providers or with the insurance companies. And as a result of this, we find that the cost of healthcare in the United States has actually been going up faster than in most other economies of the world for a variety of reasons. Most importantly, the higher cost of medicines and therapies because of the nature of the US system. Now, let me quickly turn to another alternative, which is quite popular in very few countries actually in the West. It is mainly the system which has been inherited in Germany and a few other European countries, which is called social health insurance. Sometimes it is used, other names are used. And what we find is that as a result, social health insurance has a huge range of problems, which I will go to in a minute. But I think it is important to contrast that with government finance healthcare, with government healthcare financing, where you have much more risk pooling, for large population, the national populations. It is much more efficient and cost-effective. Many people don't realize this because you eliminate the whole bureaucracy of insurance. It is less expensive and also more sustainable for the same reason. Now, let me quickly show you this graph. And what you see from this bar chart is that the spending per capita is highest in the world in the US. And the main reason is because of health insurance administration. Because it is so dysfunctional, the US spends a lot of money on healthcare, but they do not have very good outcomes. They are number one in terms of spending, as a result of, despite spending so much on healthcare, they are only number 40 in terms of life expectancy in the world. So we have a lot of problems, which I won't get into right now because of time constraints, but I think it is important to recognize that social health insurance is also not sustainable in the long run for a variety of reasons. So you have upward pressures on costs also because of the use of insurance mechanisms. There are various problems which economists call moral hazards, which I referred to earlier as well. And you have provider-induced demand. So, for example, you have a problem where the healthcare provider, including doctors and specialists, they basically will recommend certain procedures, not because they are needed, but because these procedures, through recommending those procedures, they will get some income. So you basically introduce a lot of perverse incentives with social health insurance. And then you have, as a result of various other problems, including the private nature of pharmaceutical spending, of pharmaceutical provision, medicines, the cost goes up. So this is very important for us to remember, because many people think that social health insurance is better than a private or voluntary health insurance. It is better in some ways, but it is still suboptimal. And that's the point I'm trying to make, that because you're paying so much for insurance mechanisms, it causes a lot of problems. One of the other consequences is that where you have social health insurance, in many countries where they have social health insurance, the employers try to avoid making contributions. And what do? They do not directly employ workers. Instead, they employ workers indirectly through various types of contractual agreements to avoid paying their contribution to social health insurance. So the entire cost of the insurance is borne by the population. And this, as a result of this, so you have, as a result of this, the labor force is much more involved in what are called informal labor relations, less formal employment, and there is a smaller base for collecting the revenue, and also smaller base for collecting social health insurance. And this, in some economies, I'm not saying this was shown by a former World Bank economist named Adam Wagstaff, who passed away, that there is, as a result of this, increased unemployment in the OECD countries, decreased contributions, and decreased coverage. So all this is basically important, because many people think that social and health insurance is better, especially people who are trained in the US. Because when they are trained in the US, they know that private health insurance and voluntary health insurance is a problem, and they think the better alternative is social health insurance. And but we have to recognize that the social health insurance is increasingly unsustainable because of the factors, including what is called a demographic transition, where people are getting older, and as a consequence of getting older, the health costs in society are rising, and this is inevitable when people get older. And it's also important to recognize that in societies such as Germany, where you have social health insurance, What you also have as a consequence is much more government spending to compensate for the increasing gaps left by the social health insurance system. So, for example, going back to another comparative chart, you will find that the health spending per capita in the world, number one is the US, almost 10,000 per capita per annum. And then Germany is number two. The reason Germany is number two, I know it's difficult for you to see this bar chart, but Germany is number two precisely because of the additional cost of health insurance and managing health insurance. Because when you have an insurance system, a real insurance system, okay, you find that many people are trying to try to abuse the system, not only healthcare providers, but some others as well. And as a result of this, you have the insurance companies to make as much make as much as possible. They try to ensure that kind of cheating does not happen. And when they do that, what happens as a consequence is that you have a situation where you have a bureaucracy just for insurance, got nothing to do with providing healthcare, just for insurance, for managing insurance. So this is very important to recognize because people often think that it is cheaper, but in fact, it is not cheaper. And it's also important to remember that in some societies, for example, in Canada or in the UK, they talk about national insurance, but in fact, national insurance is not insurance as a system which actuaries and others know. Rather, the system is really one of it is really based on taxation, which the population pays, rather than an insurance mechanism. And so you can change the incentives. I'll come back to this later. So the social health insurance claims to address two problems, which I would say are not true. Number one, it claims to raise more money, which is not true. And secondly, it claims to integrate the public healthcare with private sector. And obviously, you need to change incentives, but in a tax finance system. But basically, I'm going to argue that these are both not honest claims. You do not raise more money through social health insurance. In fact, you have less money for healthcare. You might raise more money for the insurance mechanism, but as I told you, most of the expenditure on the insurance system is wasted on insurance. On the insurance system, it is not used for healthcare, and this is important to recognize. So this is an article from this data is really taken from the World Bank, and the World Bank, there's this man named Adam Wagstaff who unfortunately passed away some years ago. He basically said, you spend much more money. That per capita spending on health goes up by about 3 to 4% without corresponding improvements in health outcomes, simply because you're using an insurance mechanism. And you also have worse mortality rates for certain types of morbidity conditions, such as, for example, breast cancer, because there is no incentive. Because the whole emphasis is on therapeutic or curative medicine, there is no incentive to, for example, do much more on public health and so on. This is the bias which is introduced by the health insurance system. So, and you find that in most societies, people resist health insurance because for them, they just see it as another form of taxation. They are trying to avoid not just the employers, even ordinary people, self-employed people, and this becomes a huge problem. So you have much more fairer society and greater access to healthcare, especially when you have a tax finance system. Now, let me Now, the next point I want to make is that when you have a revenue or tax finance system of health financing, it is much more egalitarian. It is also contributes to nation building, because everybody feels that they're part of the nation. The nation provides, and they feel part of this nation. And it also helps a lot to move towards various globally recognized or internationally recognized norms, which I referred to earlier. Okay, so the next point I think, which is important to make, is that the challenges for government provided healthcare is that we find that especially when you have a private system coexisting with the government system, that some people who are basically out to make money may choose to go to the private system, or they might choose to go abroad and so on. And let us not deny that there are such cases as well. And you also therefore find that people, many of the most experienced staff may go to the private sector to become specialists in the private sector, where they can earn much more and so on. So it is very important to recognize this and to provide incentives to ensure that people who are working in the government healthcare system are sufficiently remunerated. You can't treat them badly and expect them and treat them just like any other public servants. And it's very important also to recognize that the care services in our societies, the so-called care economy, is generally underfinanced. So by financing health, you're also addressing the lack of financing for the care economy. So the next point I think, which I would like to make here, is to recognize that there have been very uneven improvements in health indicators, and there is a lot of campaigning by private health insurance lobbies in all our societies. In my country, which is a developing country, upper middle income country, we find this, but it is in many societies, because the whole insurance system will collapse once you have a serious commitment to government provided healthcare. So the next point I think I'll just make very quickly is that the norms, the international norms which I referred to earlier, of providing universal healthcare more equitably and so on, and sustainably. This is very important, and to promote social solidarity and provide a certain degree of cross-subsidization. You will find that this is all very much achieved through government-provided healthcare rather than through insurance systems. So healthcare system reforms are very important, and I think it is important for us to recognize that healthcare reforms are essentially things which need to be addressed much more systematically. But there's no one answer about how to ensure what are the best healthcare system reforms which are needed. The financing part is very, very important, but it is also important to recognize that in many societies there are specific challenges. I mentioned one earlier, which in my society and in many other neighboring countries is a problem. People don't want to stay in government service because conditions are not well, and you often have bureaucrats who are making policy rather than the professionals. And all this is important for us to recognize. So just solving the financing problem doesn't mean that all the problems of improving healthcare are solved. The next point I want to make is just to remind you that my own society, we made a lot of progress before. during the 1960s and 1970s. But from the 1980s, with a lot of pressure, with a lot of emphasis on privatization and so on, we have seen some progress, but it has been less progress. And we have had a big problem of increase of what are called non-communicable diseases, which are problems which many societies, as they become better off, lifestyles change, and you have a new range of problems. In some societies, for example, you have problems relating to smoking. In other societies, too much sugar consumption, and so on and so forth. And these are often related to a whole range of other health issues and so on. So I don't want to belabor the point about Malaysia, but I think it's important to recognize that there are problems in all our societies which need to be addressed, and that the whole question of financing is part of a larger challenge. So it's also important to recognize that now there are new ways of looking at many of these issues. So and one of the popular measures are what are called dailies, disability adjusted life years lost, and this is important to recognize, because the usual measure of focusing on life expectancy is just not good enough. Now, in Asia Pacific countries, because I suspect that most of the people who are watching at this hour are from this part of the world, you can see that there has been progress, but very, very relatively modest progress, especially among men. Female life expectancy is actually much better throughout the East Asian region, and there are many reasons for this, which I won't get into right now. But in my country, for example, the gap between male and female life expectancy is between 4 to 5 years on average. And so one has to think about the challenges for providing for healthcare for older women, who often find themselves living on their own. And especially as society is becoming more atomized, and there is less family support and so on. So we have to also recognize that primary healthcare spendings have generally lagged behind what are called secondary and tertiary healthcare spending. And we have to make sure there are enough allocations to primary healthcare. Now, this is almost impossible for most people to see and read, but it basically implies that there are many deaths which are avoidable if you have a better health system. I won't get into it right now because you can't read it on the screen, but I think it's also important to recognize that very often we find that the healthcare systems, especially when they are not on the basis of government spending, and you do not have enough emphasis on public health, many non-communicable diseases are undiagnosed. In this country, for example, it is estimated that half are undiagnosed. In other countries, it is probably, other developing countries, it's probably higher. And so, for example, almost the entire population has at least one NCD risk factor, and these are real problems which unfortunately do not get sufficiently addressed. And of course, we need to recognize that at different stages of life cycle, there are different health needs, and we also need to recognize, for example, the different health needs of women compared to men. One of the major problems, for example, which has been highlighted in Malaysia only in recent years, is that many poor women cannot afford to deal with the menses, and they use old rags and so on to deal with the menses, and this introduces all kinds of infections which are very dangerous, some of which are very dangerous, and even some people suggest the possibility of cervical cancers. Now, let me stop here in case there are any problems of clarification which need to be made